question today is, how will you know if you have AIDS?
Okay. Good question. First, let's go over HIV, because a lot of people will interchange the words HIV and AIDS. First, you have to have HIV. As HIV develops and it goes through stages, it becomes what we call full-blown, it will develop into AIDS, and where you have the secondary diseases. How do you know? Well, like I said, you won't know until you start seeing or feeling signs and symptoms of the disease. The signs and symptoms will start anywhere between 2 to 4 weeks after exposure. Now, the symptoms could be as mild as just a simple flu, or it could be so severe where you have to be hospitalized. It all depends on the amount of virus you're exposed to. Let's say you were exposed to a very, very small amount and you become infected and you just have like a common cold or symptoms of a common cold. You feel achy, you feel fatigued. After 2 or 3 days, your immune system really kicks in and starts to fight the virus, because the virus is a foreign body. So automatically the immune system will start to attack this foreign body, and that's what the immune system is designed to do. Initially, the immune system is strong enough and it can affect and attack and control the virus. After the so-called window period, you start to feel a little bit better. You go about your business. You won't know if you're infected because now you're back to your everyday daily activities. And then you go in for an annual physical, and you'll see me, and I'll do a full blood work, a comprehensive workup, and my medical assistant will ask you, would you like to have an HIV test to see what your status is? And you will say, sure, I'm fine, there's nothing wrong with me. And a year later, post-exposure, you find out that you're HIV positive. Conversely, like I said, you could be exposed to a large amount where you start to have severe symptoms within 2 to 4 weeks, where you're getting a severe pneumonia. You're just really sick. Viral pneumonia. It doesn't have to be bacterial pneumonia. It could be the viral pneumonia. Viral encephalitis, where you have the virus going to end up attacking the brain. And you rush to the hospital. There we do a comprehensive workup, and they do an HIV test, and you're diagnosed at that time, and that's a short period of time. So when will you be diagnosed from signs and symptoms? That all depends on the exposure, how much you're exposed to, how long you're exposed to it, and how often you see the doctor.
I believe that Tara has a question, and also Brandon has a question.
Okay.
With some of the things we discussed, and Tara, you go ahead.
How long does it take for a person to know they have AIDS?
Well, that's what we just covered. That's real difficult. It all depends on how their exposure and their immune system. The stronger their immune system, the longer the symptoms might take for them to acknowledge, through their body, where you start to see the signs and symptoms. It could take anywhere from months to years. I'll just give you an example. I had a patient 4 years ago who was diagnosed with HIV, but it only took 4 weeks for her to become diagnosed. This particular strain is what we call the killer strain. If you remember in the media, we had a killer strain. That was a brand new strain, and that was about 4 years ago, maybe 4.5 years ago, where the time of onset to the actual signs and symptoms to the time of death was 4 to 6 weeks, because this particular strain is extremely aggressive. And I'll give you an example. My patient came in, she just wasn't feeling well. She was just fatigued and asked for a B12 shot because she would get a monthly B12 shot. Nothing in her life has changed other than she had a new partner, a significant other, and she was not sexually active for a very, very long time because she was raising her children. She felt that her children are raised now. She wanted to go out and start meeting new people. She met this individual, and she started having, unfortunately, unprotected sex. So from the time of unprotected sex until the symptoms got so severe that she required hospitalization was 4 weeks. I received a phone call that she was HIV positive. So the time from her exposure to diagnosis was 4 weeks, and it was From post-exposure, 6 weeks out, she died because she was exposed to extremely aggressive form of or strain of HIV, and in that particular year, it was called a killer HIV. Thank you.
Okay, now I know that there's treatment. That there's treatments for HIV and AIDS. But why haven't there been a cure yet?
Okay, that's a good question. Yes, we do have treatment. There's different protocols. We have antivirals. There's all different categories of antivirals. Every year, we're able to, and blessed by God, that we're able to come out with a new medication. Unfortunately, these medications are very expensive. I remember when I was in my residency, I was in my second year residency, we had the HIV convention up in Canada, and that particular convention is where all the experts throughout the world came together, and they came up with a new protocol, and that protocol was the HIV cocktails. And there's where we had 3 different medications in 3 different categories where we were able to address the HIV virus. We were able to attack it from all different areas, because there's different areas where we would like to address. There's multiplication. We can also prevent the medication from entering a cell, trying to prevent the HIV virus from multiplying. So we do have medications to treat. We don't say cure. And this is something that people don't understand. When I say people, I'm talking about our viewers and the nation and people in general. In medicine, we don't talk cure. We talk about treatment. We don't cure, we treat. Because if you cure, that means it doesn't come back anymore. Well, a lot of infections, they come back. They will repeat itself. You can have cancer can go into remission. Then all of a sudden it comes back because it will change. We have what's called runner cells, and these runner cells all of a sudden wake up and they multiply, and next you know you have cancer again. So we don't talk about cure, we talk about treatment. We have treatments for HIV. We also have treatment for AIDS. Like I said, AIDS is a syndrome, and it stands for syndrome, where we will address each secondary or super infection. Just give you an example, you can develop a PCP pneumonia, and we can treat the pneumonia with antibiotics. And hopefully with the treatment we can strengthen the immune system with the antivirals and the antibacterial medications, and hopefully your immune system starts to increase and fight again, where you're stronger and you can go about your everyday daily activities. Thank you for your question. It's a wonderful question.
I believe Alex has a question, came up in the meeting, and it makes a lot of sense. Go ahead, Alex.
How you doing? Can you get AIDS by kissing?
Okay. Well, that's a good question, because a lot of people, they have a phobia to HIV. Well, if I kiss someone, if I shake their hands, if I share utilities, utilities, no, we don't share utilities, utensils, okay, like the forks and knives and so forth, or even share, your cups. All the studies? No, absolutely not. I know there are a few studies that I was reading up, and they suggest it's a very, very low risk, and I'll give you an example, because there's always someone out there that will form an argument. In order to transmit the disease, you would have to have an seriously open wound, and the individual who you're kissing would have to have another open wound, and they would have to actually have active bleeding, and you would have to have a lot of exposure over a long period of time. So in essence, all the studies say no. So kissing, no. The studies also suggest that the HIV is not found in saliva. So part of kissing, you have saliva exchange. However, there are other viruses that you have to worry about, such as herpes. You can exchange herpes through kissing and sharing of utensils, not utilities. All right, thank you.
How bad is herpes?
How bad is herpes? Herpes can be, it can be as simple as just a cold sore that just is annoying to something very, very severe. And severe, I mean, it can affect your eyes where you can go blind. Because you can have herpes. Herpes is not just found in the genitals. Herpes can be found all over the body. It all depends on where the virus is absorbed through the abraded tissue. So it could be on your hands, it could be on the genitals, it could be on the lips, it could be on the cheeks. Like I said, it could be found in your eyes. So if you're exposed, you could go blind. So that's pretty significant. The other issue is if you have a cold sore or a canker sore or a herpes sore on your lip, there's a stigma attached to it in the community. So a lot of people, they don't want to walk around with this a blister or this swollen lip. So there's a stigma associated to it. Sometimes that's just as painful as other people knowing, that you have the virus itself.